Uh, Welcome to Rare Connection, the podcast that shares the stories, science, advocacy, and human experiences behind rare diseases and serious medical conditions. I'm your host, Joanna Ball. Today's episode is a special one because it marks the third anniversary of Rare Connection. 3 years ago, Rare Connection began as Nutrition Equity, a platform focused on the Medical Nutrition Equity Act and improving access to medically necessary nutrition for individuals living with inherited metabolic disorders and other qualifying conditions. As the podcast grew, so did the conversations. I found myself with patients, caregivers, advocates, researchers, and healthcare professionals whose stories extended far beyond a single piece of legislation. What began as a U.S. focused advocacy project eventually evolved into Rare Connection, creating space where people could share experiences, research challenges, and hope from around the world. Today's conversation also is another milestone, my 10th international episode. Over the past 3 years, Rare Connection has featured guests from Canada, Uruguay, Guatemala, India, United Kingdom, New Zealand, and now the Netherlands. While healthcare systems may differ, the experiences of patients and families facing serious illness often have much in common. I can't think of a more fitting guest for this anniversary episode than Dr. Margarite Goiter-Stam. Dr. Goiter-Stam, his background includes surgery, oncology, pediatric palliative care, and her work with Make-A-Wish International. Her career has focused not only on treating illness, but also on understanding how medical decisions affect quality of life, emotional well-being, and long-term outcomes for patients and families. Today we'll discuss patient-centered care, quality of life, pediatric palliative care, emotional support, and the role hope can play during serious illness. We'll also explore how healthcare professionals balance medical treatment with the human side of healing. Whether you're a patient, a caregiver, healthcare professional, advocate, or simply someone interested in learning more about the experiences of others, thank you for being here, being part of Rare Connection. It's a journey over the past 3 years. And now let's welcome Dr. Margarite Goiter-Stam to the show. What first inspired you to pursue medicine?
Well, first off, Joanna, thank you for a beautiful introduction, and I'm really honored to be here. So, what inspired me to get into medicine? It's quite a story, actually. As a young girl, my grandfather was a general practitioner, and I always looked up to him. So, being a doctor was, well, the only path I could think of. But a moment that really marked my career is when I was about 16 years old. I saw a show on the Dutch television about a girl who had a neuroblastoma, stage 4, dramatic outcome, and she was going to pass away. And the whole TV program was about her marrying her parents at this theme park in the Netherlands. She was dressed as a beautiful princess. And her parents were so proud and sad all at the same time. And that's the moment when I thought I have to get into pediatrics. And have to do something to alleviate the suffering for these children. Um, and I took some paths along the way. I mean, I became a pediatric surgeon first, but I got there, and I'm working as a pediatric palliative care doctor. And who would have guessed?
Yeah. So your background includes surgery, oncology, pediatric palliative care. Uh, what drew you, what drew you towards these areas of medicine?
Well, surgery is quite an active profession. So it's acute, it's active, it's taking care of somebody. It is mostly acting, and I really loved that. But what I missed, being a surgeon, is the attention for the whole person behind the ill person. So, for example, I did a lot of oncology in surgery, and deciding whether to operate or not is a question that is rarely asked. So, asking actually the person you're about to perform surgery on, preferably in advance, how do you feel, and what will you do if this makes you better, but how does it feel if it doesn't work out? And what will life look like? And having those conversations with all my patients taught me a lot. And mostly having these conversations with the patients who we were about to perform surgery with a real horrible outlooks or very small or slim chances of survival. And it taught me that time it can be just as valuable as surgical outcome. And sometimes we cannot guarantee surgical outcome, but we can guarantee some time with friends and family if we do not perform surgery.
Mhm. So how has your perspective on patient care changed throughout your career?
So it changed from being the one in the shock room, treating everything and being on top of my game with a lot of adrenaline, to being the one who is always prepared to have that difficult conversation. What do we do? What do we do to make you better as a whole person? And what do you need? Not only medication wise, but in all areas of life. And how can we help you?
Mhm. So what are some of the um, emotional realities families face during long or complicated medical journeys?
Mm. So, one of the things that always strikes me most is when a family is pulled apart. So, when there's an ill child in a family, then the ill child will need treatment at some facility, often not the nearest by their house, which means that the family is pulled apart. There's often one parent going with that child and the other one home with the rest of the children. And that is one aspect that really touches me, because it is so harsh on families to be away from each other, all with your own worries, and actually really being pulled apart. And that is one thing I wish we could solve.
Hmm. So your work has also included research focused on long-term surgical outcomes and quality of life after serious illness. Can you explain the focus of diverticulitis study in a way that non-medical licensed listeners will can understand?
Yes, absolutely. So this was actually, I did my PhD in whether to perform surgery or not in people who were suffering a lot from the diverticulitis. And the outcome was to perform surgery. And it all had to do with quality of life, because that's what we measured. So we looked at the quality of life of two different groups, and the quality of life was significantly better in the group that we did perform surgery on. So that is a case in which surgery will enhance someone's life. Um, And those are the conversations I had in the outpatient clinic with all these patients. And we even ended up having the group that was not performed surgery on initially. A lot of them did have the surgery done afterwards and with good results on quality of life. So that was actually, those were my first steps into what matters most.
Hmm. So the study discussed balance short-term risks with long-term quality of life outcomes. Why is that? Why is that balance is so important in medicine?
Because the short-term risks can have long-term outcomes. So any risk of a surgery can impact life in a great way, good and bad. Uh, and long-term quality of life is a thing that is really hard to predict. So that is a fine line you have to balance in
Hmm.
making choices in your outpatient clinic. And it's often a line that is not discussed because it is a hard conversation to have when you actually don't know. I mean, we don't have a globe to look in. We can't predict the future. We can't always predict our outcomes. So those are hard conversations.
Yeah. So the research found fewer reoperations and lower long-term stoma rates in certain patients treated
Yeah.
with laparoscopic lavage. How important are those long-term quality of life considerations when making treatment decisions?
To me, they are actually the most important things to take into consideration. I mean, a temporary discomfort leading to a better quality of life in the end, in my opinion, can
Yeah.
be acceptable when discussed well with the patient. But it's all about the conversation.
Hmm.
And if there's not much time left in life, then of course the balance strikes out in a different direction.
Do you think medicine sometimes focuses heavily on uh, immediate survival without fully discussing long-term impact on daily life?
Yes, because that is the easiest thing to predict. It's easier to talk about when we do this or that. Next week you will experience that, and the week after this. But really, the prognostics of the long term, as I said, those are so hard. So that makes the conversation hard. And uh, I believe nowadays more and more doctors are willing to have the hard conversations. I think we're really making a change in medicine. I see it all around, and I'm really happy and proud to be among the ones that have made that change. But in older days, we were not used to having those conversations. It was not normal, it was not expected, and I think it's a good thing that we're coming to this now.
So, what changes are you seeing?
I see a lot more doctors who are willing to accept their own discomfort, um, their own not knowing, and their own admitting that they are also subject uh, to what is going, how the body is going to respond, or not exactly being able to predict what will happen, and that's actually a form of not being in control, and we are, I think, more willing to accept that we cannot control everything.
So, this study also emphasized involvement in decision making. Why is shared decision making so important?
I believe that shared decision making is one of the hardest things there is, um, because and it's also one of the most important things, and I think it's a true art to actually be able to do proper shared decision making, because when I look at a child with a certain disease, it doesn't really matter which disease, but most probably I've seen a child like that before, and most probably I have an image of what life will look like for that child. And when you are the parent, you most probably do not have this image or these images in your head. Um, so getting across the true nuance of what this will mean for them in life, what this will mean in terms of decision making in the medical process, is one of the hardest things there is, and it's also one of the most dangerous things there is, because having a bad experience with 3 patients with a similar disease doesn't mean that number 4 will be the same. So shared decision making in that sense is the hardest thing there is. But if it works out and you can provide an image of what life will look like, which is similar to the spectrum that there is, I think you've done a great job. And then you will truly be able to take along parents on the journey of their life. And we also know from research that parents often say that especially in pediatric palliative care, uh, they miss being aware of the true outlook in life. And I think it all has to do with how hard these conversations are, but also how beautiful they can be if you get it right.
Hmm. So a lot of what we've discussed, emotional burden, quality of life, and patient-centered care, uh, are also connect to your work with children and families through Make-A-Wish International. Um, many misunderstood, many misunderstand palliative care and automatically associate it with end-of-life care. How would you explain pediatric palliative care?
So palliative care is the whole spectrum of children um, born with or ending up with any type of disease that will shorten their lifespan. But that does not mean that it will be shortened in terms of weeks, months, or days. It can be years, and maybe even decades. And the difference with like terminal care, of course, is that it actually coincides the last part of that life. So children can be palliative a whole life long, as we say in our country, which is absolutely different from that last part of life.
Mm-hmm. So can palliative care exist alongside curative treatment?
It should. It should, because I believe that there's a lot of things you can treat in a palliative person, as long as you get, again, there I go again, the conversation right,
Mm-hmm.
and speak about what is desired, and what this part of treatment that they will receive will do to their body, but also psychologically and in their family system and in all things that matter.
So what emotional needs are sometimes overlooked in healthcare?
So as I said, I think we're coming from times that emotional needs did not play a role because it was all about the cure. And I think we have totally entered a different era, and I'm happy with that. And but it's hard when you have outpatient clinic, 20 something, 30 something children with their families in a day, and you also have to see them all. It is hard to sometimes be able to really um, have the time to see the child for who the child is. And I don't think it is so much overlooked anymore, but I think it is a time aspect, and it's also an audacity aspect sometimes, because still some caregivers just it is a safe spot to talk about
Mm-hmm.
illness. It is a lot safer than talking about how you feel and what you're afraid of, and what you're hoping that your life will look like, and what we can do, and but also talking about things that are not possible anymore, and how we can help a patient and family deal with that.
So yeah, and the cure side of things, cure is still pretty big because almost every nonprofit is a cure this, cure that.
Yep.
It's
Yes, it is. Every nonprofit, well, a lot of nonprofits are about donate so we can cure, and I think that
yeah,
is a really, really good thing that it's there because, I mean, if we want to make progress in a cure, we need money for research.
Yeah.
However, the flip side is um, we do need to admit, everybody, we need to admit that sometimes cure is just not an option. And
Yeah.
quality of life is the greatest good there is. And even if time is short and we are only able to provide a family a proper goodbye,
Hmm.
a way of parting. They say parting is such sweet sorrow, and it is. And if you find a way to part in a good way, even though it's painful, you do a lot of good to a lot of people because it will absolutely help out the family that is left behind in their coping, in their mourning experience, in the way other children go to school and make something out of life. So I think it's a really great good and we do need funding for that as well.
Hmm. How does uncertainty affect children and families emotionally?
Well, the uncertainty of how life will go, it is a big one, and on the other hand, children are so resilient. It is so much. Well, I wouldn't say fun, but it's so rewarding to be in pediatric palliative care because children will truly say, "I will die, and tomorrow I'll be a firefighter, or I'll be a firefighter when I grow up." And that is a way of going about life and about looking on the bright side that is unmeasurable and unknown in adult palliative care, which I also did or even still do sometimes. Um, so uncertainty affects a whole family. It affects every aspect of life. It affects planning from trips to schools to because children who are ill can go to school. Do not ever make that mistake because children who are ill also grow and develop and want to make something of themselves. And then you have that uncertainty on the other side, uh, pulling them towards not knowing what will happen and not knowing if there's time to finish the education that they really wanted to do because they still also think, even though they're dying, that they will be a firefighter when they grow up. And that is
Mm.
absolutely inspiring to me.
Yeah. I don't think they understand a lot of what they're going through, so it's uh,
And they
yeah,
do, because children who are not told that they are dying, they feel and they know.
yeah.
Um, I think they understand a lot, but their outlook on life is so different from us
Mm.
adults. And we know that children from the age of 8 onwards, for example, start copying their parents' mourning behavior.
Mm.
And I don't mean mourning as in your cup of coffee, but mourning as in loss.
Yeah.
And that is not always a good example. And so discussing death and dying with children under the age of 8 is so different from children who are older. But when
Hmm.
discussed properly, um, we can help children a lot.
Hmm. How do siblings and caregivers experience serious illness differently?
For siblings, I always say illness is very dual. I mean, you have your brother or sister that is ill and you feel sorry for them and you want to help them. On the other side, on the other hand, it's still your brother and it's still the
Mm.
one who's just annoying and it's still the one you fight with, and that is so good that still happens. And then another part of it is that it is the one that's also taking up all attention from grandparents, from parents taking time away from you, and it can cause a lot of jealousy. So it is it's a struggle for siblings. And then when a child passes, and it stays a struggle because children, they grieve in stages. In every development they make, they grieve some, and so it is. We say that children who lose a brother or sister grieve in average for 80 years.
Wow.
80 years, that is a lot. Um, and I'm not saying it's easier for parents because, I mean, as parents, we want to take care of our children. We want to see them grow up. We want to see them flourish. and then you have one passing, and you need to say goodbye, and you don't want to say goodbye. On the other hand, you want to do good to your child, but also the siblings, and how to be a good parent in all these emotions and being pulled to every possible side. That is one of the hardest things.
Hmm.
And I know I lost one of my children, one of my four children. So I have that experience myself as well, and it is hard.
Hmm. So, what do you wish healthcare providers understood about emotional support for families?
That we need to ask families what they need, um, because families are all different. And that is the best part about our planet. We are all a little bit different. And we need to ask what they need, and they will not be able to answer always, but we need to read between the lines and dare to ask. And if you don't find a way to connect with your patients or the family, ask your colleagues for help. Um, we need to have some more guts to just say it out loud and ask families. And know that you will never actually know what it's like. Um, Nobody. I will never know for all my patients what it's like for them to have that ill child, to have their child pass, because every family is different. And that's why we always need to ask.
Hmm. What drew you to become involved with Make-A-Wish International?
Well, Make-A-Wish started in that TV episode when I was 16, which I told you about
Hmm.
before, and that was actually the Dutch organization that actually is now Make-A-Wish Netherlands. So
Hmm.
um, that drew me to Make-A-Wish, and then the former director asked me if I could play a role being a pediatric palliative care doctor in helping them with all the diagnoses they came across. And I could not have been more proud to join Make-A-Wish Netherlands. And from that point onwards, I came in contact with Make-A-Wish International, and they asked me to be part of their medical committee, and being able to make impact on that scale, thinking about all children all over the world who need emotional support and who need that little extra besides their medical treatment, is a gift to me. So I happily do that.
How do wishes affect children's emotionally and during serious illness?
A wish is a form of looking forward. It is being special in a good way instead of in the way of you being ill. It is really being seen. And it actually, for children, really feels as if they're really being seen by their doctor as well. And then Make-A-Wish comes along, and they will ask you about your dreams, and they will not just ask you once. They will
Hmm.
really sit with you and ask you, and really find out the dream behind the dream, and actually the true heart's desire. And when you are able to fulfill a true heart's desire, children feel seen in such a way that doctors, nurses, and hospitals will never be able to reach, and which is fine, because that's not our primary goal. But having Make-A-Wish do this, you see children who come back into your outpatient clinic in your and they, well, in Dutch we would say they walk on clouds, which is a quite a
No.
strange expression, but you see that little hop in
Yeah.
their step. It is different.
Hmm. Have you seen emotional or psychological changes in children after a wish experience?
Absolutely. What we know, and also is confirmed in literature, that, for example, they feel less fatigued, less headaches. So sometimes even medication is lessened afterwards, and it all has to do with that being seen, being heard, and knowing that they're special in a good way as well.
Hmm. Can hope and anticipation positively affect emotional well-being?
Absolutely, absolutely. That's another thing that we've learned from our research, but also other research, that difficult emotions can be um, how would I express this? They can be alleviated by real positive emotions. So it's not like they disappear, but they are not felt as heavily as they normally would be. So yes, absolutely, hope and anticipation are those extremely positive feelings that will alleviate all the harsh ones.
Mhm. How do you wish experiences how do wish experiences affect caregivers and siblings?
Well, as you can imagine, Joanne, looking at your child laughing, smiling, enjoying whatever expression your child is able to make, to show that they're having a good time from their toes up to their head, is something that truly touches parents who otherwise see their children in agony and pain and treatments as well. And same goes for the siblings. It is so good to see somebody you love so much truly enjoying a moment.
Mhm. Is there a wish, a story, or patient experience that has stayed with you emotionally?
Yes, absolutely. I had a girl in my hometown, and she really wanted to become a doctor, and um, she really wanted an experience in a hospital to be a doctor, and we provided that in my own hospital. And this girl will never be able to be a doctor, but seeing her enjoy that, we had a lunch break, and we were in the lunchroom, the doctor's lounge, and I had instructed some of my colleagues to walk in and tell her hi, and I'll just use a different name now, but hi, Sophie, Dr. Sophie, how are you doing? How's your day? And those words from my colleagues just lit up the girl. She was smiling, and that smile never disappeared from her face. And the best part was that her sister tagged along on the wish that day. And after the whole wish journey, her sister was already part of the whole wish journey because her sister was really important to her. And her sister was actually the one who also wanted to become a doctor. And that day, her sister tagged along and had the same great experience, and actually managed to uh, make sure that she had an internship in the hospital, which also ended up bringing really good memories back to the Wish Child a few months later. So we had actually this prolonged wish journey, prolonged wish experience with the whole family that was overjoyed by something that was actually so simple, that by something that was just a girl in the hospital and doctors telling her, "Welcome to the doctor's lounge. How was your day, Dr. Sophie?" How easy can it be, yeah?
Yeah. Are there differences internationally in how families experience emotional support during illness?
Yes, absolutely. I mean, the the cultural differences across the world are great, and also the way we deal with illness, disease, and communication about illness and disease is different, and the needs of people are different. And then combining that with just the normal different cultures and doctors being different, yes, there are great. It really differs all over the world, and same goes for what children wish for, of course. I mean, being from the well, I'd say that the richer countries, the wishes can sometimes be different than people who live in different circumstances, and that's absolutely logical. And as long as the wish is a heart's desire, then it's all good, and we will make the same impact.
Mhm. So, what message would you most want patients, caregivers, and healthcare professionals to take away from today's conversation?
Well, I think I want them to take away that 82,000 children a year across Make-A-Wish affiliates are diagnosed with a rare disease and are eligible for a wish. Um, and that we grant wishes in nearly 50 countries. And actually, to make that number even more well, to make it enter your heart a little bit more, every 25 seconds, a child is diagnosed with a critical illness and becomes eligible for a wish. Every 25 seconds. So we've been on this for a little bit. So imagine how many children are eligible for a wish, even in the span of our conversation alone, Joanna. Um, and being able to grant these wishes will help children and their families, will help them in their positive emotions, that will alleviate symptoms. It will give them a different outlook on life. Will give them a sense of being supported and being seen that is unheard of. And I think as doctors, we should all make sure that our children that are eligible for Make-A-Wish end up in a wish journey. And as others listening to this rare disease podcast, I think if you're able to support Make-A-Wish in any way, either by volunteering, either by making a donation, or even talking to your friends about it and keeping it true to your heart, then you are helping us a great deal and all these children.
Mm-hmm. So, what are the qualifications for a wish with Make-A-Wish?
The qualifications for what?
For Make-A-Wish
Well,
with Make-A-Wish for the wishes.
yeah, for children to become eligible for Make-A-Wish is that they have to have a life-threatening or potentially lifespan-shortening illness. And then every country will has their admittance, and every country does it in line with Make-A-Wish International, but will decide themselves if children are admitted for a wish journey. So I will only encourage anybody to sign up and yeah, do that for the children who are really in need of these wishes.
So thank you again, Dr. Goiter-Stam, for joining me today and for sharing your perspective on emotional and medical aspects of caring for patients and families facing serious illness. Today's conversation really highlighted the healthcare that healthcare is about more than procedures and diagnoses. It's about it's about quality of life, emotional well-being, patient-centered care, and helping people find hope during difficult medical journeys. To everyone listening, thank you for being part of the Rare Connection community. If you enjoyed this episode, please subscribe to Rare Connection on your favorite podcast platform and follow my YouTube channel, Rare Chef, where many of these conversations are also available in video format. If you're watching on YouTube, I'd love to hear your thoughts in the comments below. And if you're listening on audio platform, you can also send me a text. You can use the send me a text link in the show notes to share your feedback or suggest future guest topics. You can also follow Rare Connection on Facebook, X, and LinkedIn, and stay up to date on future episodes covering rare disease advocacy, research, caregiving, clinical trials, and patient experiences from around the world. As always, this podcast is for educational and informational purposes only and should not replace professional medical advice. Please consult a qualified healthcare professional regarding any medical concerns or treatments decisions. And before we end today's episode, I want to remind everyone that mental health matters. If you or someone you know is struggling emotionally or experiencing thoughts of suicide, please Help is available. In the United States and Canada, you can call or text 988 for the Suicide and Crisis Lifeline. In the Netherlands, the support is available by calling 113. If you are elsewhere in the world, please contact your local crisis lifeline, your local crisis hotline, emergency services, or mental health support organization in your area. You don't have to go through difficult moments alone. Okay, so the next episode is with a veterinarian. She's testing a feline leukemia drug for long COVID in humans. So it crosses borders there and boundaries here. So that one's in a couple of weeks here. Thank you again for listening to our connection. And I'm Joanna, and see you next time.